I'm Dr. Donica Baker, a rheumatologist with medical specialists at St. Luke's Hospital. I grew up here in Chesterfield. For college, I went to the University of Michigan in Ann Arbor, and I came back to Missouri for medical school and my fellowship as well. I specialize in rheumatology, which has to do with arthritis and autoimmune diseases. I see a lot of patients with rheumatoid arthritis, lupus, conditions that affect the immune system and cause a lot of pain, fatigue, and other symptoms. I was always interested in the musculoskeletal system, and I really wanted to help patients improve their quality of life and be as functional as they possibly could be. I thought it was a specialty that really helped improve patients' mobility. I really enjoy music. I grew up playing piano, was part of a choir, and I think music has always just been so healing for the soul. I enjoy helping patients become more functional, to reduce their pain, to help them improve their quality of life and be able to perform their activities of daily living. I've always loved the sciences. I've loved learning about the human body and about anatomy. In college, I majored in kinesiology, which has a lot to do with human anatomy and physiology, and that played into my interest in musculoskeletal system as well. In rheumatology, we see a lot of patients with rheumatoid arthritis. I'd say that's my biggest population of patients. I also see patients with psoriatic arthritis, which happens in patients with psoriasis and arthritis as well. I'd say lupus is another huge category of patients that we see. Ankylosing spondylitis. We also see patients with more rare diseases such as vasculitis and anti-inflammatory conditions. A lot of people have osteoarthritis, which is wear and tear arthritis that we almost all get as we get older. That's really different from rheumatoid arthritis, which is an autoimmune condition, a derangement in your immune system that causes your immune system to attack your joints and tissues rather than bacteria or viruses in the environment. And it's a very different distinction to make because the treatment is incredibly different. In osteoarthritis, we treat it more so with conservative therapies like Tylenol, ibuprofen, physical therapy. Patients may need a joint replacement surgery eventually. Whereas in rheumatoid arthritis, we treat it with medications that tone down the immune system. The symptoms of rheumatoid arthritis include joint pain and swelling, usually in the small joints of the hands, like the fingers or the knuckles and wrists. That's opposed to osteoarthritis, which causes more joint pain in large joints, like the hips and knees, which are weight-bearing joints in the body. And the cause of rheumatoid arthritis is actually unknown. If you've been diagnosed with a condition like rheumatoid arthritis, the bad news is you have an autoimmune problem, but the good news is the treatment nowadays is incredibly good. So the next steps would be to check some baseline labs to make sure your body's okay to start any new medications and ruling out any infectious diseases to make sure your body can take medications that can tone down the immune system. The next step would be choosing a medication that would be right for you. There is something called an anti-inflammatory diet that patients can eat, and it's changes in your diet. It's things like eating more fruits and vegetables, eating less red meats. It's also adding spices into your food like ginger, turmeric, or cumin, which are known to reduce inflammation levels in the body. Eating healthy in general helps you to feel better, reducing sugar, and staying as active as you can.